Welcome back, everybody. You know, one of the things we've been hearing about so much recently, the importance of having health care and of having quality health care.
Quality makes a big difference. John Moore with Mother Francis here to talk to us about it. Nice to see you again, John.
Good to see you, Bob.
You know, 10, 20 years ago, you could get great health care just perhaps in, say, the city of Tyler, the city of Longview, some of the small town hospitals closing out, not doing well. Now getting quality health care across East Texas is a reality now.
It's a good thing.
Yeah, it's a real good, especially
really
when
good.
you're our age. It's a really good thing.
It's getting even more important, isn't it?
It is, yeah.
Every day. We're really lucky. Trinity Mother Francis, specifically Mother Francis Hospital, just won a couple of really big awards. One's from HealthGrades, found that we're in the top 5% in the United States for patient safety. And the other is from Thomson Reuters. We're a top 100 hospital, and we're the only hospital in the state of Texas to get the Everest Award, which means that our improvement rate over the last 5 years has been better than everyone else's in the category.
Everest, obviously the pinnacle of getting things accomplished there. What does it all mean, though, John? When you go in as a patient to the hospital, does this mean something? Do the awards mean something? Just we know that obviously it's a great accolade for people who work with the system, but what does it mean for patients?
What it really means is it's just like anything else. You need to do your homework. You need to have a primary care physician to start with so that you have a repository for all your medical information so that if someone else needs access to it, there's a person who has it all in one place. But it also means like anything else. I mean, when you buy a car, most of us go out and do our research on the internet. We look at Consumer Reports or these other organizations that's their job, is to rate automobiles. Well, there are organizations like Thomson Reuters and HealthGrades. They rate hospitals, so it's important to pay attention to this information when it's released.
Well, and you all obviously know a lot about healthcare over there, and so what are your thoughts on everything that's been going on in Washington?
Well, I think it's a great thing that more people are going to be covered. It is a really, really great thing. But when you add that many new people to the healthcare system without adding more doctors and facilities, it's going to be more important for you to do your homework and try to get in as quickly as you can with a primary care doctor so you have a medical home, because that's what everyone else who's new to the system is also going to be doing.
You know, you stress primary care doctors. Well, gosh, I don't have a family physician, but having that base, that starting point, is vital in the rest of your health care. Having someone, like you said, to keep all the records, to know what medications you're on, and so on.
Well, for instance, Trinity Clinic went to electronic medical records a few years ago. So if your doctor is a Trinity Clinic physician and you have to say, go see a specialist, such as a diabetes physician, they can go to their own computer without having to summon for your records from the other office, wait 3 days till it's brought over.
Yeah.
I mean, it's instantaneous.
Yeah.
So you want to get in with a facility that has the latest and greatest, because if you need treatment now, you don't want to wait 3 days for it.
Thing, you can't wait. You certainly can't wait for the FedEx guy or the courier to bring the papers over.
Or anyone else.
And stop for lunch.
Right.
John Moore, always good to see you. Thanks for coming in.
Bob, Callie, thanks for having me.
John.
Okay.